Hey, hello, Caroline. How are you doing?
Morning, Mike. I'm very good. How was your holiday?
It was all right. It feels like a long time ago, but yeah, it's just always the way. But
I know,
yeah,
I know.
we've um, we've had quite a few questions while I was away that have been submitted.
hmm
Um, it's I guess the Q&A keeps growing and growing, and it's far more than we ever expected it to become, which is fantastic. But we are now receiving nearly four times as many questions as when we started, and there's around 40 that came in while I was on holiday. So that's going to take a little bit of time to work through. We get through maybe 10 a session. So I guess what I'm saying that for is just a way of saying thank you to people for their patience while we get through that, but we are going to get through them all. Um, and we're discussing best how to handle those things going forwards, and we'll let people know. But in the meantime, thank you very much to everybody for their patience. Um, the what I've done this week is I've picked out those that came in, either those that came in first or are somehow time sensitive or
Okay.
particularly topical. So I'll kind of try and move swiftly through them. But in the meantime, I just wanted to reiterate that before we started recording this morning, Caroline had kind of reiterated that she was absolutely committed to carrying on with these sessions, which was great to hear. Do you want to add anything on that, Caroline, or will I just start with the questions?
Don't want to add anything. So I think it will be. So I really enjoy these questions. They're a bit nerve wracking, and I know that sometimes I don't get the answers right, but I think this is all about us getting to a place. I think I will be content when actually I'm not getting so many questions, and this tails off because that tells me that our organisational culture is enabling people to ask questions and resolve issues that they are feeling, and that's the problem pipeline stuff that we've spoken about before. So we
Yeah.
know we need to get better at listening and being able to come up with solutions or not, but being clear about that at an earlier stage. So that'll be a good indicator. The fact that the questions are going up tells me that we're not there yet. And the other big goal for me is I want to. It'll be really great if we can get to a place where colleagues don't feel they need to do this anonymously. And we've created the conditions in NHS Grampian for people to know that it's okay to ask a question. But again, I know we're not there yet. So yeah, let's keep going, Mike. I'll try and be
Yeah,
succinct. And I know I'm rubbish at that as well.
it's all right. Thank you, Caroline. Okay, so the first question comes from Jeanette Swainston, who is team leader in Banff and Buchan with the health visiting and school nursing team. She has written, "Hello, Caroline. In the heat wave that we've just experienced, it would have been helpful if team leaders, managers, locality managers had funds to buy staff ice lollies or bottles of water to help people keep cool and hydrated and happy in the workplace. She also suggests maybe canteens could have those in place for free for staff on occasion. She points out that the impact of PPE, working with that in heat, and also that her workplace hit 30.2 in July and the difficulty that causes for concentration. Do you want to talk about that a little bit, Caroline? I know you've been asked that a few times.
Yeah. Interestingly, though, I don't think by community colleagues. So clearly, the temperatures that we experienced last week were significant, or over the past couple of weeks were significant, and absolutely had an impact on people's concentration, people's physical and mental well-being. So, Jeanette, I absolutely agree that we should be responsive and be able to ensure that all colleagues have access to whatever we need. So hydration, so cool water, and water is something that has come up repeatedly in these Q&As. And I do wonder if there are other bits of the organisation that have got this sussed, because I know, because I saw it on social media, that in other parts of Grampian, colleagues were supplied with ice lollies, etc. So I'm wondering if there's a bit of organisational learning here. And so there's a number of ways to look at this. There's our health and safety regulation in regards to our environmental temperatures, and as employers, what we must do to protect the safety of our colleagues. So that's one bit. Then there's the other bit about actually what does being a good employer look like, and at times of exception, how can we do things like Jeanette's mentioned, like ice lollies and just goodwill gestures. And I think there will be different ways to do that. The goodwill gesture bit, I'm wondering about endowments and how we could possibly work with them, because let's face it, this is not it's not a usual problem that we have in the north of Scotland. So, Jeanette, I am wondering how best for you in Aberdeenshire to pick that up. And the most simplistic way that I can think of is for Ali McGruther, who's your lead nurse, to link with Jenny McNichol, who is the portfolio lead for integrated family services and the professional nurse director for secondary care, to understand what they're doing around how do they fund it, because they do that. And between Ali and Jenny, they might get some shared learning. And then we can understand if that doesn't work, what more do we need to do? And Jenny can have that conversation with me. So that would be my suggestion. So I'm not going to take any of that away. Jeanette, I'm going to ask you to speak to Ali, please, and say that's a possible way that we could do it. But really important that we are able to provide the fundamentals, like we've spoken about before, and respond to the weather changes. Clearly, that's going to be an ongoing issue. But then there's also the how to be nice and go above and beyond. So let's have a go at seeing if there's any shared learning.
Okie dokie. The next question's anonymous, but again on the topic of heat in the workplace. Someone has asked where NHS Grampians stand on, for example, navy knee-length shorts being worn in times of extreme heat. Someone else has also asked anonymously, and outside of the context of the recent heat wave, why jeans aren't considered appropriate workwear compared to things such as leggings. Are you aware of the workplace uniform policy enough to speak about that, Caroline?
So I haven't looked at that policy for some time, Mike. I don't think it's called a uniform policy. It was more of a dress code. Oh, well, I can't remember. I think it was more of a dress code because it was to cover everybody, and we know not everybody wears a uniform at work. So that's two questions in there. So I'm going to deal with the navy shorts one. So again, in light of the last question as well, I think we need to be contemporary in our approach to what we wear, and clearly, again, responsive to the weather conditions. So actually, I'm going to answer this in three separate ways. So Caroline Hiscox has absolutely no issue with tailored navy, appropriately professional shorts. I have no personal issue with that. However, NHS Scotland has a national uniform policy, so it's not something that we would make a decision on at a local level without having explored the national position on it. I look at international colleagues who have very high standards of care, very high standards of professionalism. So it's not about that. I think what it would come down to is the supply, and what would be the uptake of it, and what would those sort of implications be for our colleagues in the sewing room, and for those that would wear them. So there is the shorts aligned to the national uniform policy. I think that we can ask that question, and actually I will ask June Brown, our nurse director, to ask that question of the Chief Nursing Directorate in Scottish Government, because I think that's where the national policy sits. And we can come back with an update on that, and then we can make a balanced decision on, if there is no appetite nationally to do that, what our thoughts are on that. My lessons learned, my life experience around uniforms, it's never an easy one. However, it doesn't mean we should shy away from it. And shorts or trousers, it's all about the public perception, public trust, and how confident and comfortable colleagues feel at their work, which takes us on to the jeans question within that, Mike, which is slightly different because that is a local decision. And so I think that I'm not sure when the policy was looked at. I would imagine that post-pandemic, it will be in a list of policies that are due a refresh and a review, but I could be wrong on that. So actually, I think we can ask Rachel Little, our employee director, just where we're at with that. I think things have changed. I think the pandemic has absolutely helped to enable individualized dressing and practical and comfortable dressing. So I think the thing that matters to me is that we are as flexible as we possibly can be in regards to giving colleagues, trusted colleagues, the autonomy to wear what they believe is appropriate for the roles that they do. And we all know, because dressing is a very individualised thing, that sometimes we don't get our dress code right. I'm sure we've all had personal experience of when we don't get our dress code right. So we do need our colleagues that are with us most frequently to be able to say, not sure that is the right thing to be wearing for whatever reason. So that's the really local kind of ownership of it. We have a policy because we require to have a policy, and it helps us to guide when things don't go as well as we would like them in those kind of local discussions. But for me, the key thing that we need to be thinking about organisationally is, are we contemporary? Are we recognising and paying attention to the needs of our colleagues to be safe, to be comfortable, and really importantly, to convey that level of trust, public confidence, and professionalism that we know the public of Grampian need and deserve. And that's not an easy one either, because that's really different. What my daughter and son would accept as appropriate dress wear, my parents might not. And we cater to all age groups. So I think we've just got to be really thoughtful about it. But if we can ask Rachel where we're at with the policy, and if I can encourage people to be practical in the local conversations that they have, and people to also be thoughtful that you are at work, so that is a professional and paid role, and use your judgment well in that. The specific jeans question, let's revisit it in the policy, because times move on, and the question, why are jeans less professional than leggings? I can't answer it. So I think it's a good question.
Okay, thanks, Caroline. The next question is on the subject of pay scales, and particularly the NHS in comparison to other careers. It's from somebody who would like to be anonymous, but they've mentioned the shortage of staff at present. But they go on to say that even the potential, although obviously it hasn't been agreed, potential 5% pay rise for a band 2 who may take bloods, do ECGs, they will still earn 50 pence an hour less than someone working in McDonald's, they say. And a staff nurse earns 10,000 a year less than a teacher. And they've mentioned also that a staff nurse would still earn less than 20,000 less than a train driver. they've stated that that doesn't make the years of training feel worthwhile, and they've asked if you think staff are well looked after by the NHS. Is there anything you can say about that one?
Yeah, a really, really important question. So thank you to whoever asked it. I'm sure many of your colleagues wish to ask it as well. So really topical. And first thing I want to say, Mike, is that we have to make sure that our colleagues in NHS Grampian are well looked after. And part of that is about being adequately compensated, and that is especially prevalent just now in regards to the cost of living, and people are genuinely frightened and toiling with that, and I know that. So that's really important. I also know that most people don't come into the NHS because it is the highest paid salaries and professional groups, and I am really thoughtful of where is the balance in regards to public service and the real drive and intrinsic motivation to help people, and that's usually one of the big motivators to care and help for people, in my experience, that bring people into the job. But there has to be a balance in regards to compensation and equity of pay. So that's about making sure that people in public sector are not taken advantage of, I think. I don't want to detract from the importance of salary, but I do want to say that actually in some regards we do have some really competitive benefits as a public sector in comparison to other public sector, and also to industry and private sector. So things like our holidays, job security, particularly in the NHS, and other terms and conditions. But I know that pales into insignificance if you can't pay the bills at the end of the month. And I do not want to see colleagues, valuable colleagues with significant skills, moving into other industries because they can't afford to live. And that's a really important thing. So for me, so do I think, I think was the question, we do that well. So fairness is really important to me. And I know that the world is not fair. So what can we do at a local level, as well as influencing really heavily at a national level what this needs to look like? And at the risk of getting too philosophical on everyone, if you take pay as a reflection of how society places value on the roles that we do across public sector, I'm not sure as a society that we've got that right all the time. And I think everybody will have different views on that. It certainly is really hard to accept that any profession or role are being compensated differently to others that are in different roles, and the importance of health. And I'm going to say social care and another public sector is pretty thought provoking. That if we think, for example, and I'm sure this comment will be criticised, but if we think that a footballer is a footballer hundreds of times more valuable to society than a healthcare worker? Of course they're not. Is that going to change? I think we're all realistic enough to know the answer to that. So I think it's a really difficult question, Mike, and it's definitely an issue that has been present for a long time, but is very relevant and very prevalent just now. I am really thoughtful of, as Caroline Hiscox, if I had a magic wand, I would want to make sure that everybody could take more home at the end of the month to make sure that their style, their quality of life and their ability to pay the bills was adequate. And I can't. So there is the national influencing role that I am doing, that is being done through our directors of workforce, our employee directors, our partnership colleagues, and those negotiations, as you said, are unresolved at the moment. 5% for Agenda for Change has not yet been agreed, and in fact I had a discussion about it yesterday at the executive team meeting. So we will do the best that we can influencing and negotiating around pay. And we need to also then understand what else matters most to retain colleagues. And that is a key focus for us this year and continuing in NHS Grampian. So I know we're not doing it well enough yet, but we are absolutely determined to keep working at it.
Thanks, Caroline. And there's quite a few questions we've had on the subject of pay and the pay scales. Just while we're talking about that, we've had 3 separate staff get in touch asking if you have any rough idea when we can expect to hear any further news on the pay deal. Each of those people have expressed the extra stress that the uncertainty is causing, particularly in the context of the cost of living crisis. And Alana Milson, one of the domestic supervisors, mentioned specifically that there seems to be a lot of rumour about what that will involve. She said she's had 3 different members of her team approach her and said they'd heard it was going to be a 10% pay rise. And generally, people just don't know where their finances are going to be in a couple of months' time. Are you able to shed any light on that? I know it's obviously still ongoing.
So just specifically because Alana's the one that's given us her name, I absolutely recognise, and I think the number of questions that we've had about it, Mike, is a good indicator. So I don't forget, a gentle reminder to colleagues watching this video that because of the issues relating to cost of living, our HR colleagues have worked really hard to have a really good signposting service through the HR hub for colleagues that are in financial difficulty. I've been on and looked at it because I was so acutely aware of the impact that fuel costs, heating, petrol were having. So I think they're working hard. So have a look at that if that's useful. Give feedback if it needs to be more or different. But specifically in answer to your question, Mike, as I said in that last question, we discussed it at the executive team yesterday. It is an ongoing national discussion at the moment. It is discussed nationally every week and locally every week. And I don't have a definitive timescale on this. What I do know is that it is very unclear if 5% is going to be accepted. And that is and this is for Agenda for Change colleagues. Clearly, we have a range of different T's and C's. And so Tom Power, who's our Director of People and Culture, sits on the National Human Resource Directors group, and the out of my team kind of hold the space on this. And so what I would suggest, Mike, is that we ask Tom to give us if there is any kind of timelines. I don't think there is, but if there is, let's get them shared with colleagues, and we make a commitment to regularly update in the brief just around where we're at with this, because I know it's a really worrying time.
Yeah. Again, the follow-up to that, I suppose, is another one on financial pressures that we've had 4 different colleagues get in touch about the rise in fuel costs and the business mileage rates, which is obviously a continuing theme in the sessions. A couple of those people have acknowledged the increase earlier in the year that you and the other Scottish chief executives helped to push through, but they've asked if it's possible to review that further in light of the increased costs since then. One of the colleagues also mentions that they're seeing increased costs at garages for parts and maintenance, so that's also having an impact. Are you aware of any plans to look at that again?
So I need to speak to Tom about it, because actually, as well as this conversation, it's been raised through other routes. So one of the conversations I've had this week, which I think is quite thought-provoking, is that whilst we did those uplifts in the pay rate for the NHS, Our local authority colleagues have not been able to do that. So for colleagues who are working in integrated teams in the health and social care partnership, actually there is an issue of equity around the mileage rates. Now, we are two separate public sector organisations, but we do need to look at how we are going to support our social care colleagues. And I know that our local authority and health and social care partnership teams are looking at that, but that's just one example. So I am going to speak to Tom to see where are we revisiting this, because actually there is also another conversation that's been put in front of me by, there's another kind of thought process question around actually what about even if we do put up the mileage rate and colleagues can't afford to pay that, are there other options around prepayment, around fuel cards, etc. And I think as we get further into winter, we need to think seriously about how are we going to absolutely ensure that we do not lose colleagues because they can't afford to drive to work. So I need to speak to Tom about it. I will, and maybe there's another conversation for Tom and I to have together and do something specific around this. But it's a really, really important issue.
Yeah, I think you've maybe answered some of this, but it comes back to that equity element that you just mentioned. But another anonymous medical colleague had been in touch on the subject of business mileage to say that medical staff were excluded from the increase in mileage rates earlier in the year, and he feels that's having a real impact now. For himself, he says that it's beginning to change how he's working. He's even had to withdraw from some face-to-face patient activity because he can't afford to keep shouldering the travel costs himself. So he's doing more remote working. He's obviously acknowledged that senior management are aware and asked if there's any suggestions of how we can move forward. I think you've maybe addressed some of that with what you said about speaking to Tom there, Caroline, but I just thought I'd add that so you've got that context.
Yeah, well, no, that's really interesting actually, because that's not my understanding. So because I got all the mileage rates put in front of me, and I've said before, we've got different T's and C's for doctors and dentists and agenda for change. And I'm sure I saw doctors and dentists in that with enhanced mileage rates. So I wonder if this, so I need to understand that question a bit more. So
Yeah.
if the colleague that's contacted you is comfortable, if they could just share a bit more of the detail of that. And what I do recall about the document that was put in front of me, and I'm sure colleagues will empathise with the number of things that go across the front of my, go across my desk, is that what I do, and I might have got this wrong, so I hope I haven't, what was different in the medical and dental mileage rates was the engine size, which I'm not sure if we do an agenda for change. Anyway, I remember the document. I was sure that doctors and dentists T's and C's got an uplift as well. So I would like to understand that more. So Mike, if that colleague is able to email me directly, then I'll understand and know who to direct it to. But thanks for the question, because that, yeah, important. Like everybody else, everybody has to be able to get to their work. So let's understand it more.
Okay, thanks, Caroline. The next one again is quite topical. It's a slightly longer question, but I'll read it out.
I'll write it
They've
down as you
asked
go.
if they've asked if there are any plans to improve ambulance stacking in the emergency department. They've mentioned the pressure this is putting on both the Scottish Ambulance Service staff and the emergency department staff. They've said that's just huge. It's causing an impact on working relationships, and between the two organisations, they feel that staff are on the verge of burning out. They've also gone on to state that patients are obviously, this is having an impact on patients. They're waiting far, far too long to enter the department to be discharged to their allocated ward, and that frustrations, perhaps understandably, from patients and relatives are being directed at staff quite often. They're also worried about colleagues becoming tired and leaving the emergency department. And they finish by saying, as a member of the team at ED for many years, it's sad to see as we're so passionate about the care we give, but in the current climate, we're unable to meet our own high expectations. I know there's a lot of work just now around that, Caroline. Do you want to just talk about some of that just now?
Yeah, so uh, as you said, a really topical question, and probably one of the things that worries me most at the moment, if I'm really honest, is the impact that people being delayed in getting access to care across our entire system. So, whether that is somebody that dials 999, not being able to get an ambulance in a timely enough way because the ambulances are otherwise deployed, more so than ever, sitting outside ARI or Dr. Gray's hospital. Delays in patients once they have been appropriately assessed in our emergency departments or our acute receiving units, then getting to the most appropriate specialty. I looked at data yesterday about patients that are boarded across our inpatient beds, and we know there is a really strong evidence base that they are not getting the best quality of care, and that will impact on their outcomes, as is the growing evidence base around length of stay. So patients that are in our emergency departments for more than 8 hours or 12 hours. And then we've got patients waiting in the community to get access to diagnostics and planned care. We've got patients waiting to see their general practitioners. And really, really importantly, we've got patients who are not getting the right level of support and social care because of the numerous challenges that we have around that. So I think this is a really valid, critical issue that this colleague has raised. And so what can I say to give a level of assurance? So you're right, there is a lot of work going on. And there has been a lot of work going on for several months now, and it has not made the difference that it needs to make. And so last Monday in the brief, I commented on the P&J article, which I don't think was specifically targeted at NHS Grampian, but NHS Grampian was part of it. And within that, there was a link from Sandra McLeod and Paul Baku in regards to launching the work around redesigning our urgent care pathways. And that's going to be a really, really important piece of work that everybody is going to have to play into. And in tandem, making sure that so that will predominantly make sure that the flow going into the hospital is as effective as possible. So patients that are needing access to services, and that's a big piece of work. And the intention is to have that well underway before winter, because obviously winter is a big concern for everybody. And then simultaneously, the work around flow out of hospitals and into the community is really, really important. Because actually, we've got this really strange position where we've got patients in the community who need to be in hospital and patients in the hospital who need to be in the community. So there is undoubtedly a level of risk associated. So specifically about ambulance stacking, absolutely. I meet with Pauline Howie, who's the Chief Executive of Scottish Ambulance Service, every week to discuss the consequences, the impact, and what both of our teams are doing to improve this. The teams are working really closely together. SAS and NHS Grampian and the emergency department is key in that, as is AMIA and Dr. Gray's. But it's much, much bigger than that. They can't solve this problem alone. This is a whole system issue if ever I saw one. In our delivery plan this year, so this is the contract that I have with the government and the board, we have prioritised 3 things. One is improving access to care. The other one is supporting colleagues. And the other one is creating the conditions for a level of reform and change that we know we need to make in the NHS, because, as I have now said many times, it is no longer fit for purpose and was never designed to do what it is now doing. So the commitment from me and the executive team and the board and colleagues, so the leadership team around medicine, unscheduled care, and the whole system is absolutely focused on getting this right. We need to make a significant change in our ambulance stacking, in our patients waiting for longer than 8 and 12 hours, patients that are delayed in that transfer into the hospital and out. And that is the work that is underway. So my ask is I need everybody to join in on that, because nobody has the solution nationally. So we need to come up with new and innovative ways to do this. And people that are immersed in these services are the ones that are going to know the answers to that. So there are stakeholder events ongoing just now. I wonder if we could put, Mike, the link, and I do wonder if we need a kind of specific, there's a link to the video from Sandra and Paul, but there's also stakeholder events that Michael Coulthard is coordinating as the programme manager. So I wonder if a conversation with Michael would be helpful to see what we could put in the brief. But particularly for our ED colleagues who raised this question, let's make sure we've got a specific response going back in there, because they're absolutely right. This is not what we want or what our patients and colleagues deserve. It's a really, really difficult situation.
Yeah, there's another colleague who's actually been in touch, and I think they'll be reassured to hear you talk about it as a whole system issue. It's a nurse from one of our community hospitals who's been in touch anonymously, but she said herself and her colleagues are finding it frustrating and upsetting about the length of time inpatients are waiting for care packages to get discharged home safely. She's mentioned that those prolonged stays are even leading to scenarios where somebody becomes unwell. Even after rehab, they become unwell again and may never get home, and that opportunity is missed. I guess they've themselves went on to state the impact that this has on the wider system, on GPs, on ambulances, on acute hospitals. I know you've talked a little about that there, Caroline. Do you want to add anything specific there, or do you think that's covered with the whole system approach you mentioned?
So no, because I'm recognise my answer was a bit lengthy the last time, but I think it is because it is one of our highest colleague and patient safety risks just now, and we all need to play our part in resolving it. I'm not going to say anything else other than it's absolutely every single bit of the system that is toiling, and that we're not alone in that. That's every health board in Scotland, and indeed a UK issue. So that's cold comfort, I know, but I absolutely believe that we have the relationships and the opportunity to do this, to make the best of the whole system. And I think what we should do when this goes in the brief, Mike, is to have some sort of contact that any colleague that wants to participate and has a thought that they want to contribute to the redesign work that's going to commence, that is now commenced, to improve access to urgent care, then they can contact, whether it's an email account or whatever. Let's make sure we put that in the brief. And if anybody wants a specific session with their team, then please also ask for that. If you just want to, because sometimes it's just about knowing what on earth is going on to try and make this better. And in the absence of any communication, that's difficult to know, and people tend to make up their own stuff. So let's make sure that we create the opportunity for that two-way dialogue, because we need to.
Okay, thanks, Caroline. The two colleagues, the next one, they're both anonymous, but two colleagues have been in touch. They're from ARI, and it's about the junction between the multi-storey car park and Ashgrove House. That's the one at the top of the bus lane, which I think is Forester Hill Road. One of the colleagues says she's seen, or in fact she was nearly involved in a number of near misses in the last few weeks, and I've asked if the road markings could be refreshed, as they're far too faded, she thinks. another colleague's also mentioned that the crossing closest to the staff car park, could that be reactivated? Just for people's awareness, this is one of the questions that I flagged to Caroline in advance because I knew she may well not have been aware of it before. So I think, Caroline, you made a few inquiries about this before we started today, didn't you?
Yeah, and it's just great to be able to bring some positive responses. And I think if we, look at the question that was posed about ambulance stacking and the complexity of that, and which makes things like this, and the brilliant colleagues that we have in facilities and estates, who are, I believe, going to repaint the road markings and get that sorted. So huge thanks as always to Chantal and the team for being so responsive. And it's great to have some technical fixes that make life just that little bit easier around things like that when trying to deal with so many complex issues such as the ambulance stacking. And it is a really tricky junction. I cross that road regularly and find myself watching several times before I so I think that's a really good call. And I think the prompt was because, as you can imagine, colleagues in facilities estates are not having to seek work to do. So again, this was quite useful in regards to the volume of asks about it, and so helpful. So thank you to Chantal, thank you to Mike for picking up the theme, and hopefully we will have a date soon in regards to when that will be painted and the lights switched back on.
Okie dokie. I think this will be the final question for today, Caroline. This is again anonymous. It's a colleague who's asked if you know how much notice people should have to give for annual leave to attend their own graduation. This colleague, who I believe is a member of nursing staff, asked in March as she was graduating in July and was told she couldn't get the day off, which seems a shame. Is there anything you can add or comment about that, Caroline?
So, as I've said in slightly different but similar questions, when there's a difference of opinion between a line manager and a member of the team, there's usually more depth to it than that. So on the face of that, actually, that does not feel right at all. However, I would suggest that you contact the HR hub. And I'm not actually sure because I don't know off the top of my head the notification periods of leave. However, graduating is a really, really important celebration. The amount of work and personal commitment that you will have put into that, and indeed the organisational benefit that we will receive from that because of your enhanced skills and knowledge. So I would hope we could find a way forward with this. And it's always important to understand the perspective of both. And so a conversation is always the best way to do it. But if that's not resolving it, then have a conversation with the HR hub and seek advice from them in regards to the graduation. Although we've obviously missed that in the timelines that you've just described, Mike. So let's understand what happened there, and maybe if you pick that conversation up, if they're anonymous, Mike, if they're go to the HR hub, have a conversation, and I would be keen to understand what the outcome of that was.
Yeah, okay, I can check that with them directly. Okay, Caroline, thank you very much. As I said, grateful to everyone for their patience as we get through all of the questions, and we haven't got another session booked in yet, but I'd imagine it will be very soon, hopefully in the next week or so. So yeah, I'd just like to thank Caroline again, and we will see you again shortly.
Thanks, Mike. Have a good day.